logi or logos. Heme is blood, and logos means to study. So, in simple terms, hematology is the study of blood in health and in disease. In hematology, we study the blood cells as well as the tissues that form the blood cells. When I say blood cells, you may have heard of red blood cells, white blood cells, platelets. We study these cells in detail in most of the work that we do. The results that we get in hematology can be classified as either qualitative or quantitative. You are thinking about numbers. And so it means that some of the results that we churn out in hematology have numbers, and so they have units, whereas others are qualitative. Don't forget. Right. So, like I'm saying, the results we give out in hematology are of two main types. We have the qualitative, which we only observe and report what we see, like uh, your sickling test. It's either you are sickling positive or sickling negative. Your malaria parasite test, it's either we see malaria parasite or we don't see. So we report as malaria parasite seen or no malaria parasite seen. That's qualitative. Now with the quantitative, we have tests like the full blood count, where we are counting our blood cells. So we get values, say 10.0 gram per deciliter for your hemoglobin level or your red cell count. So all the quantitative, they have units attached. And you have to be careful to attach the correct unit, because if you change the unit, you have changed the value altogether. We'll get into all those details as we move along. We also have hemostasis. Hemostasis is another branch of hematology where this time we study how our bodies prevent us from bleeding out and dying. For example, as you are here today, some of you probably go prepare food after here. If you are chopping your onions and you mistakenly cut yourself, you will notice that almost immediately, if you apply some pressure onto the site where you cut your finger, almost immediately the bleeding will stop. It's not magic. The process that allows this to occur is called hemostasis. And so in hematology, apart from studying the blood cells and the tissues that form the blood cells, we also study how our bodies have this amazing capability of preventing us from bleeding out in case we are involved in an accident and cut ourselves, for example. So hematology tests, we in hematology, we often so in hematology, we often brag, at least I do, that you cannot go to the hospital and the doctor will not ask you to do any simple hematology test like the full blood count, because hematological tests can give important information about a patient's general well-being. Somebody can come into the lab looking like tall like some soldier, but you do their full blood count, their HB is as low as a pubertal female. So doing these simple tests in hematology can give a general idea. The tests we do in hematology, like I said, can give crucial information to the doctor about the patient's general well-being. The tests we perform in hematology also help us to detect diseases like anemia. Anemia is a low red blood cell count. We can also detect leukemias. Leukemia is a cancer of the blood. We can also detect if a patient has inherited a blood disorder like sickle cell anemia and so on. So the test, every branch of medlab comes together to help us to know what's wrong with the patient. But hematology, we cannot go without hematology because your blood gives you life. And hematology, we study blood, both in health and disease. So hematology is absolutely crucial for us to be able to know what is going on with a patient. All right, so let's move on to the next slide. Right. So we said in hematology we study blood. How does blood flow throughout our bodies? Of course, we need a pump to be able to do this, and the heart is the pump that helps to pump our blood all around our body, supplying the nutrients and gases and protection and whatnot. That's our blood, the functions our blood performs to all tissues in our bodies. Okay, good. So we have two main pathways that help to supply blood around our bodies. And of course, these pathways come from the heart. We have the pulmonary circulation or cardiopulmonary circulation, and then we have the systemic circulation. So, since this is not an anatomy class, I'm going to keep it very simple. The pulmonary circulation is a very short loop from the heart to the lungs and back again to the heart. Whereas in systemic circulation, now with systemic circulation, the blood that return that I said in cardiopulmonary circulation, the blood goes from the heart to the lungs and back again. With systemic circulation, it means that the blood that has returned to the heart by this time has picked up lots of oxygen from the lungs, because the blood I said went from the heart to the lungs, picked up oxygen, and returned to the heart. And so the blood that returns to the heart must have picked up lots and lots of oxygen. So in systemic circulation, it carries blood from the heart this time to all other parts of the body and back again. Please note the difference. Whereas with a cardiopulmonary circulation, the blood is pumped away from the heart to the lungs and then returns to the heart. Now, when this blood goes to the heart, when this blood goes to the lungs, I said it picks up lots of oxygen because we are breathing in and out. This oxygenated blood that returns to the heart through the cardiopulmonary system. Now, the systemic circulation will carry this oxygenated blood from the heart to all other parts of our bodies and back again. These are the two main pathways by which blood is transported throughout our bodies. Now, the circulatory system all together, both your cardiopulmonary and your systemic circulation come together to form what we call the circulatory system. Now, what's the importance of the circulatory system? Because I said blood is carried along in both the cardiopulmonary and systemic circulation. The blood contains oxygen, which we breathe in through our lungs. It also contains nutrients, water, hormones, and all sorts of micronutrients that our body needs to survive. Additionally, it removes waste products, including waste gas from our body, so that our blood or our system is not poison. Blood also regulates our body temperature. It's because it transports your white blood cells, which are involved in fighting infection. Also, blood helps to protect us against. So, all these functions of the circulatory system that I have listed are carried out by the blood that the circulatory system carries. And blood is a fluid. It circulates through our blood vessels and bathes our tissues. Now, when I say blood vessels, we have three main types of blood vessels. Okay, very good. So, blood is circulated through our bodies with these three main blood vessels. Now, the average adult human body contains, if we were to measure in distance, our blood vessels altogether is about 60,000 miles of blood vessel. If you don't know what that means, that's the mileage. If we add all our blood vessels together and we stretch it out like in a tape measure, we are trying to measure, that's how much distance our blood vessels travel. So that you can imagine that there's lots and lots of blood vessels throughout our body for the obvious function of supplying blood, mostly oxygenated blood, to all our tissues, no matter where it is found, from the head, the hair on our head to the tips of our toes. Every tissue, no matter where it's hidden, needs to have blood, regular blood supply. And our blood vessels make this possible. So in general, when we say an artery, arteries usually carry oxygenated blood, whereas veins usually, there are exceptions. I'm saying usually because there are some exceptions. Arteries usually carry oxygenated blood, whereas veins usually carry deoxygenated blood. All right, so let's go to composition of blood. Okay, so in hematology, we said all we do is to study blood, and so we'll be talking about blood in excess. Don't get bored when you hear blood, blood, blood. So let's talk a little bit about this blood I've been talking about. So that if you take the average human and you take their weight, blood makes up about 6 to 8% of your total body weight. Blood is water, it's a fluid. In fact, when you take the average adult, their blood volume, if we were to pour it into containers, it's about 5 liters. So if you know the 1 liter bottle of water or Coke or whatever, about 5 of them, if you fill it to the top, will make up the total blood that you carry around in your body. Do you think that's a lot or it's too little? Some people do think, like, really looking at me, a big person like me, only 5 liters. But I think 5 liters is a whole lot. Now, blood is composed of these cells that are suspended in a fluid. The fluid is called plasma. Now, when we said blood makes up 6 to 8% of your total body weight. Now, if we take blood in itself and we separate the cells from the liquid, we said blood is blood cells, that's your red blood cells, white blood cells, platelets that are suspended in a fluid. The fluid is called plasma. If we take blood, about 50 to 60% of the weight of blood is actually plasma, which means the liquid plasma forms up a major part of blood. The rest is all mostly red blood cells. Red blood cells are the most popular in number. I hope you are following what I'm describing. I said when you take blood, it is red blood cells, white blood cells, platelets that's suspended in a fluid which is called plasma. Now, the plasma occupies about 50 to 60% of the total blood volume or space. Now, the rest, apart from the liquid plasma, the rest is mostly red blood cells. In fact, when you look at blood, it looks red. So, a lot of people think blood is just red blood cells. But no, blood also contains white blood cells, not because they look white. And then we also have platelets. We'll talk about them as we go along the course. Now, plasma, we said, is mostly water, and the rest is solids and proteins and carbohydrates and so on. Plasma also contains what we call the coagulation proteins. I mentioned earlier that when you cut yourself, you will almost immediately stop bleeding if you apply some pressure. For that, it's your platelets that are responsible for the first response. We have 2 lines of response. It's just like when somebody has an accident. The first people who are around the site of the accident, they try to help. Then they call for, say, an ambulance, or they transport the injured person to the hospital. The same thing happens when you cut yourself or you're injured. Immediately, platelets are the first responders. They will come there and form what we call a temporary platelet plug to prevent you from bleeding, because we need blood. Our tissues need blood to survive. So when you cut yourself and all the blood leaves your body, then you go into hypovolemic shock and death occurs. Our body is very smart. It doesn't want that to happen. So immediately when you get a cut or you are severely injured, your platelets will quickly assemble at the site where you injured yourself and temporarily prevent you from continuing to bleed out. Then your clotting or your coagulation proteins will now come in to form a more permanent plug. What's the difference between the temporary and permanent plug? So with the temporary plug, you cut yourself after a few seconds, the bleeding stops. Now, if you are not careful and you bump that site again or you hit that site again, you realize that you begin to bleed all over again based on our own life experiences. Anytime you have an injury and the injury is not severe, a minor cut or bruise, you notice that after a few minutes, it depends on people, seconds, minutes, depending on the severity of the injury, the bleeding stops. But if you are not careful and you are walking past the table and you hit your finger or your leg, the place where you previously hit yourself, you will notice that the bleeding will start all over again because the platelet plug is only temporary. Now, the coagulation proteins come in to form a more permanent plug so that now you have a scab, is black. It usually covers your site where you hurt yourself. So that sometimes you have to deliberately peel it off before it will even come off. We call that a permanent plug or clot. And your coagulation proteins are responsible for this. They allow it to happen. There are about 13 of them. Every normal functioning human being has these coagulation protein, which are activated when you hurt yourself, so that they form a clot, a blood clot, to prevent you from bleeding. So when you take blood into an anticoagulated tube, when we say anticoagulant, we already said coagulation is blood clotting or stopping from bleeding, and we have anti or anti. So it means anti is against. So anticoagulation, it means against coagulation. So what does an anticoagulant do to blood? So when we obtain blood from a patient, in hematology, we do not want blood to clot. Please note, the chemistry guys, they love clotted blood. That's all they use because they want the serum. So let me quickly explain what I mean. When we take, I said blood is a liquid. It has blood cells floating in plasma, which is a fluid. That's for the hematology people because we want our blood to be as close to how we obtained it from the patient. Nobody can survive if their blood is clotting by heart. No, everybody's blood is a fluid so that it can travel through the blood vessel. And so when we obtain blood from a patient, we want the blood to remain liquid, just like how it is found in the blood vessel. If we do not keep our blood in anticoagulant tube, what will happen is the plasma coagulation proteins I talked about will be exposed to air and they will become activated and they will quickly cause the blood to clot. The guys in chemistry, they like coagulated blood because when they centrifuge or they spin the sample, the liquid that will come on top it's called serum. Let me just spell it for you. Serum is SERUM. So serum and plasma are very similar. They both look yellow. They are both fluid. But we get plasma from blood that has not clotted, whereas we get serum from blood that has clotted. So blood, I said it's liquid. When you obtain it from the patient fresh, it remains liquid. But within a matter of seconds, as soon as possible, if you plan to keep it liquid, you have to keep it in an anticoagulant tube. Otherwise, the blood element will be exposed to air and your coagulation proteins will be activated and your blood will clot. The people in chemistry, that's exactly what they do. They put a sample in a plain tube which does not contain any anticoagulant and leave the sample to sit. After some time, the red blood cell, the white blood cell, the platelets, they form a thick clot, leaving serum at the top. In hematology, that's a disaster if your sample clots. Even if the sample, we have what we call micro clots, tiny little clot that you can't even see with your eyes. That sample is no longer viable for hematology testing. And so our aim in hematology is always to keep our sample as liquid as possible. So when you obtain your sample and you leave it to sit on the bench, undisturbed for some time, you will realize that the cells begin to settle out depending on their weight. The red blood cells are heavier, so they settle at the bottom. Plasma is light, so it's at the top. Then we have this layer between plasma and red blood cells. We call that the buffy coat. So if you look at the picture on your screen, if you can zoom it and you see the buffy coat. For some patients, even the buffy coat is so thin that you can't really see it if you are not careful. It's so thin, but it forms this whitish kind of layer on top of your packed red blood cells. And your buffy coat is where your white cells and your platelets are, whereas the packed red cell at the bottom is your red blood cells, and then on top is your plasma. So you can understand what I mean by the red cells are they make up most of your blood. When you take the plasma out, you will see that your red cells are the most numerous. And your buffy coat, that thin layer over there, is where your white cells and your platelets can be found. This is typical hematology, what we expect to see when we take whole blood from a patient and put it in an anticoagulant tube. For chemistry, all you will see will be clotted blood at the bottom and then serum on top, slide 7. So the cellular elements of blood we already mentioned are the red cells, white cells, and platelets. But they all have unique names, just like how we all in school we have official name. But when we go home, I'm sure everybody has their own name they call them at home. The red cells, white cells, platelets are the common names we give to them, but they all have special names. Red cells are called erythrocytes, white cells are called leukocytes, and platelets are called thrombocytes. We commonly call these cells blood cells in general, and most hematology tests are designed to evaluate or measure the function of one or more of the 3 blood cell types. Right, now let's talk about the red blood cells. We already said they are the most numerous blood cell. On average, they live for about 120 days in circulation. So that's the lifespan of your red blood cell because of the important function that they perform. They are many, one, and they live long if you compare the lifespan of the white cells to platelets, for example. And they remain in our blood vessels. It's important that they remain in the blood vessels. If red cells escape into our tissues, then we have a problem. For example, probably some of you have experienced that you go for a simple blood draw, you go for your sample to be taken, and the technologist or whoever in charge is not experienced or they are struggling to take your blood. Before you know it, the site begins to swell, for example. We call that a hematoma. It means the person has used their needle to puncture your blood vessel. So now your red cells and the plasma and are escaping into your tissue. And that's why you see the site beginning to swell. If the needle remained in the blood vessel, this will not occur. So it's important that because the blood vessels are the ones helping to transport your blood to your tissues. If now the blood cells are escaping into the tissue, we have a problem. So it's important that our red cells remain in our blood vessel. Now, if we take a microliter of blood, I don't know if you can appreciate what a microliter is. Micro is times 10 to the power minus 6. So that's really small of a liter. The liter of water that you know, imagine times 10 to the power minus 6. So that's really, really small. Each microliter of blood contains about 5 million red blood cells. That's a whole lot.